everybody, welcome back to my channel. My name is Saima. I'm from Pakistan. I'm a nurse currently practicing in the UK, as you all know so far maybe. So today's video we are going to talk about inhaled medication and its procedure in the Osce exam, how we do it within the time provided and how we do it accurately. So let's start the video. As I said, today video is inhaled medication. We call it in short term Aim, administration of inhaled medication. So the procedure of the inhaled medication is a skill station. You get 12 minutes in the exam to do it, and then it's the same procedure. Start with the pre-procedure. If the examiners don't ask you to start with the actual procedure, if they say start with the actual procedure, start right away with the actual procedure. No need to do pre-procedure check, no need to introduce yourself, no need to prepare the equipments. If they say start with the actual procedure, start with the actual procedure right away. Maybe the trolley is already being prepared for you. You take the trolley to the patient and start the procedure. So if they ask you just start with the, you are going to give this injection, they'll give you a paper. You are going to give inhaled medication, and then prescription will be there for you. You are going to give, let's say, salbutamol 2 puffs, and they'll give you a valid and legible prescription with all the rights of the medication. But it's your responsibility to check again the 6 or 7 rights of the medication, and then before you give any kind of medication. So inhaled medication is still a medicine. Consider it as a medicine. It is a medicine, right? But it goes through a different route. So consider it like doing it as injection, because I know some people, they don't consider it seriously, but still it goes inside the patient's mouth. It affects directly, right? It's a critical thing that some people, they just ignore. They don't consider it as medicine. Please make sure that you know that inhaled medication is still a medication, and then you need to follow all the technique as we do in the injections. The pre-procedure, as you know, you enter the room, you check for the scene safety, you maintain patient privacy, close the curtains. If it's a community setting you going to, you need to close the doors, and then tell the patient your reason of before doing that, you need to perform hand hygiene. Good point. So you need to perform hand hygiene, stating all the process involved, all the steps of hand hygiene you need to explain to the assessor. After hand hygiene, you're going to introduce yourself. If you went to their house, you're going to tell them why I'm here and what's the reason of this encounter. Then you need to check the patient ID, name, date of birth, and hospital number if they are in the hospital. If they are in the community, you need to check name, date of birth, and their address. Yeah, so after introduction and ID check, you're gonna check the patient allergy status. Ask them if they have any allergies and what is the reaction to that with that allergy. So after that, you need to ask if patient is in any kind of pain, if they need any health teaching, or if they're using if you're giving them inhaled medication. Ask the patient, right, if they know how to use the spacer device. If you're using the spacer device, ask them if they are using just the inhaler without the spacer device, what's the procedure. You're going to explain them, you're going to give them the teaching how to do it appropriately. All right, guys. So after all the introduction, we're going to prepare the medication. We're going to check the prescription. If it has 6 hours of the medication, right patient, right drug, right dose, right time, right documentation, signature, and everything. If the prescription is valid and legible. And then also you're going to check the batch number and expiry of the medicines that you have, and also that if the inhaler or the spacer device you are using, whether it's clean, whether it's been washed or cleaned according to the manufacturer guidelines. If any piece of the information from the prescription, whether it's route or doctor's signature, is missing, you are not going to proceed with the prescription. You're not going to proceed with the medication administration. So we have checked our prescription is valid and legible. We have a spacer device. Our inhaler is in date. Batch number, expiry date is perfect, and the spacer device is clean, and we're using it for the first time. Now the most important thing in the inhaled medication is to remember patient is sitting upright. Whether they prefer in bed or in chair, they should sit upright to permit full expansion of the diaphragm, because they're gonna inhale the medication to have the optimum effect. Now we are with the patient, right? We started with the procedure already. We asked the patient to sit upright for full expansion of the lungs, for full expansion of the diaphragm, and we're going to give them the teaching. We're going to tell them how to do it properly. So they are in the sitting position. You're gonna check their name, date of birth, and hospital number, address if they are in community. Check the patient allergy status again with the patient directly. Confirm with the papers you have if they are a hospital, ID band and your notes and patient verbal. Three checks, right? But if they are in community, you have your notes and you are going to ask the patient and then confirm their address. So two checks if you are in the community. So, and then after that you're going to check the allergy status against if they are in the hospital. I said you need to check date of birth, name, and hospital number against the prescription and with the patient. If they are in the community, you're gonna check the patient with the patient verbally and with your notes and your prescription. Yeah. So after that you're gonna ask the allergy status, as I said earlier. Then you are going to remove the mouthpiece of the inhaler and mouthpiece of the spacer device. Here is the important point that you need to remember, that before you give any inhaled medication or any kind of syrups that we give, any kind of medication, we need to shake it well before we use. So you're gonna shake it for 3 to 5 seconds so the medication is mixed properly. So here we are using a spacer device. We have removed the cover of the mouthpiece and mouthpiece of the spacer device. We've removed the cover of the mouthpiece of the inhaler. So we're gonna connect the inhaler at the end of the spacer device. I should have brought it here to show you guys. So you need to connect the spacer mouthpiece of the you need to connect the inhaler device at the end of the spacer device, and then ask the patient to exhale completely, and put the mouthpiece of the spacer device into their mouth to make a seal around the mouthpiece. It is an important point that you need to remember. You need to tell the patient, please tip your head back slightly, inhale slowly and deeply through the mouthpiece, and then press the canister fully. The canister is our inhaler, the canister contains the medication. So sometimes I know there are students who forget to tell them that they need to press the canister also. So if they don't press the canister, they are just breathing in and out air only. They are not getting their medication. So they need to press the canister, inhale the medicine in and out for 5 times. If we are using the spacer device, they need to do it 5 times. You're gonna count it loud. Breathe in, out, 1, 5 times we're gonna do it if we are using the spacer device. We use the spacer device because it improves the delivery of correct dose of the inhaled medication, and then also the medication distribute directly to the airways during the inhalation. And also why we tell the patient to breathe in slowly and deeply, so the medication can reach the airways instead of hitting at the back of their throat. If they're gonna do it in a short sharp huff like that, in a short sharp in one inhalation, it's gonna hit at the back of their throat. So we are not going to tell them do it quickly. No, breathe in deeply and slowly so the medication can reach your airways instead of hitting at the back of your throat. And then also spacer device ensure the correct dose of the medication they inhaled, correct dose of the medication. So we did it for 5 times, we counted it for 5 times, and then we remove the mouthpiece device before exhaling through the pursed lips. So the last one, yeah. So every time they having a seal, they are having a spacer device in their mouth, right? So they need to breathe in 5 times, but the 5th time they're gonna breathe into the spacer device like through their pursed lips slowly, and then you can remove the spacer device. Yeah, so if we don't use the spacer device, they can do it, we don't use the spacer device, they can do it, sometimes they do it one time, sometimes they do it 3 times, so it's according to the instructions of the doctor. But if we are using the inhaler device, if we are using the spacer device, we need to do it 5 times to get the correct dose to our airways. And then also we need to instruct the patient that they need to wait 20 to 30 seconds between the inhalation if we are using the same medication. But if we are using a different medication of for the inhalation, then they need to wait 2 to 5 minutes in between the inhalation. So let's say they are getting 2 puffs of salbutamol, so they need to wait 20 to 30 seconds in between 2 puffs. Yeah, the procedure is the same. For 1 puff with the spacer device, 5 times they're gonna inhale, breathe in and breathe out. Yeah, but if they're using the different medication, they need to wait 2 to 5 minutes in between the medication. Like here we give salbutamol, and then we gave 2 puffs, right? And then it took us maybe 3-4 minutes. Yeah, so again with the procedure, we're doing the procedure with the inhalation, like 2 puffs we gave. So with 1 puff they need to do it 5 times, and the second puff they need to do it 5 times again. Then now we just need to wait 20 to 30 seconds in between these 2 puffs. Yeah, if we're using another ipratropium bromide or something else, then we need to wait 2 to 5 minutes before we can give them the second puff, before we can give them another puff of the other medication. We need to tell the patient that they need to administer bronchodilators first, then the steroids, and make sure whatever the instruction you give them, you know the rationale behind it. Yeah, you need to know why we are telling this to the patient, why we are telling them to wait in between the inhalation. We are telling them to wait in between the inhalation to get the maximum effects of the medication. It's the same with the bronchodilators as steroids. They get the bronchodilators first, it will act on their bronchioles, and then it will give us maximum effects of the medication. So you need to, if patient asks you, why are you telling me to do this, nurse? What's the benefit of doing this, nurse? So you should know why I am going to tell this to the patient. What is the rationale behind it? All right, guys. So now we have given them their medication. So what is the important thing? We need to document. We need to document that we have given these puffs, and then make sure, guys, you do proper hand hygiene throughout the procedure. You don't have any other equipments. You are just using your alcohol gel, and you have a spacer device and inhaler. You don't have anything else, right? You don't need to wear gloves. You don't need to wear apron or anything. Just your hand hygiene, your spacer device and your inhaler. And then make sure at the end that you discard all the things that you have used, discard whatever if you used, and then say thank you to the patient. Document that you have given this medication, what time did you give, write your print name, write your signature, and then that's it. Make sure your patient is comfortable, patient is safe before you leave. And then if they don't need anything from you, if they want to go to the loo, if they want to drink a glass of water, offer them, and then leave the patient safe and comfortable. Guys, I would say familiarize yourself with the spacer device and the bronchodilator, with the inhalers here. And then spacer device, we use most of the times in the hospital, but some people, they don't like to use spacer device. They just use the inhaler right away without the spacer device. Spacer device enhance the correct dose of the administration of the medication. For old people, if they cannot hold the bronchodilator for long, it's good for them to have the spacer device, so they can get the medication directly and then the correct dose. Yeah, and make sure you familiarize yourself with the spacer device, and make sure you ask the IDs of the patient. Check if your prescription is valid and eligible, has 6 hours of the medication, and you are doing proper hand hygiene. If you touch the patient, if you touch the spacer device, and if you have touched the inhaler or whatever, make sure you do hand hygiene throughout the procedure. Say thank you to the patient before leaving. Ask them if they have any concerns, if they have any kind of pain or anything else they want you to do. So these are the things that you need to remember when you introduce yourself. Ask the patient, tell the patient your reason of the encounter. I mean, these basic things are very very important. Like, we are not just going there to do our thing, just to give them their medication, and we are not making any bond with the patient. Yeah, so this is important. Without, before giving your medication, you have a connection with the patient. You introduce, you ask them how they are doing, if they have any problem, if they want you to do anything before you give them medication. I mean, you're not just going there and give the medication and go back. No, make sure you make a bond with the patient. You have limited time, you have 12 minutes, but this one is not a long procedure. It's just the educational thing, it's just the teaching that you need to do. So make sure you do your best. I hope this video was helpful. If you like this video, please give it a big thumbs. It motivates me to make more videos, and I feel happy if you like the video. Please guys, please share it with your friends. Whoever is preparing for OSCE, please share it with your friends, and then subscribe the channel if you like my videos. I'll see you soon in the next video. Bye then, take care. Bye bye.